thanks. This is an important part of our statewide launch of a Healthier Tennessee initiative. Tennessee, we have a lot of great things happening, but if we do have some things we need to address, and one of those is being healthier. It was discouraging yesterday when the national report on childhood obesity came out, and the nation as a whole was getting better on that, but Tennessee was one of the few states that went backwards. And so one of the things we're doing is, like I said, launching the statewide campaign that will focus on exercising more, five times a week, 30 minutes a day of some type of movement, eating better, and then either not using or not starting to use tobacco. And those three things we think can make a world of difference. The difference in this and other efforts is we're really going to have a focused campaign, measure results with lots of feedback, and we've brought together people all around the state to make certain it really is a statewide effort. I'm excited about the difference this can make in Tennessee, and I'll add one more thing. This can make a difference in job recruitment as well. When companies look at where they're going to locate, they look at scores of factors, but one of the key ones is healthcare costs. And the healthier employee base that they have, I think the better, the more attractive will be for companies to continue to locate here. So with that, I'll stop and take questions.
Can you kind of explain some boots on the ground with this, where this will be implemented? Will be schools, community centers?
The initial focus of the implementation process really will be in workplaces, schools, and in churches and community centers across the state. We want to see more employee workplace programs. We want to see more of these kinds of wellness programs in schools all across the state. And then we think church communities and community centers are another opportunity for this to be the place where people start to engage in healthier behavior that we're talking about.
Will this be voluntary participation, or how will that work out?
It is voluntary, of course. It really comes down to people having the motivation and the information to get engaged and get active in changing behaviors. In the case of workplaces, there are usually opportunities for some rewards and some incentives related to health insurance, because most employers do provide some form of health insurance coverage, and it gives employees an opportunity, if they participate in these kinds of programs, to have lower health insurance premiums because they're healthier overall over time.
Is that dependent on an insurance company to participate in this program, or can you explain how that relationship works a little better?
Well, a lot of companies have health savings accounts of various forms, and you can save more on what you pay if you have healthy behavior. I know when I was the mayor in Knoxville, we put one of those in the city, and it made a drastic difference in containing healthcare costs and in terms of us finding potential issues with folks down the road. So I think what you're seeing is a lot of employers are recognizing that a lot of the issues we have with health in Tennessee are behavioral choices. And the more we can do to encourage better behavior, healthier folks, and better bottom line for businesses.
Is the Tennessee government plan going to include those incentivizations for employees to be healthy?
Yeah, we are looking at that with our own state employees. We're putting plans in place for both for incentives for our employees, but also one of the things that helps is then once we start measuring, then we'll have a little friendly competition as well between areas and departments.
Yeah, you mentioned healthcare costs as a way you intend to track this, but what are some of the other ways that you hope to be able to measure any results that come out of this initiative?
We'll initially begin by measuring awareness. Are people really aware of this as an issue in Tennessee? Then how engaged are they? How involved are they becoming in these programs? Then we'll start looking at changes in behavior. Are they getting more regular physical activity, eating healthier food, and is the rate of tobacco use in Tennessee going down? About 23% of adults in Tennessee still use tobacco products, and about 21% of high school students in Tennessee use tobacco products. So we'll be looking to see whether changes in behavior happen or not. And then finally, we'll be able to look at outcomes and say, are we reducing healthcare costs for behavior-based diseases?
Is it just the childhood obesity numbers in Tennessee that went up, or just any of the other numbers also?
The study that came out yesterday was just measuring childhood obesity, so that was the one number that, like I said, because it's so current, that struck a bell. And literally, like I said, I think there were only a handful of states whose childhood obesity numbers went up, and we were one of those, unfortunately.
Will you all have any funding for any of these organizations that you're working on?
We have two sources of funding. The state of Tennessee granted $6.2 million to the foundation, $5 million of that from tobacco settlement funds, and $1.2 million from the governor's budget. We have raised more than that amount, so more than $6 million from the private sector, and those funds will go to programs that like the ones we're talking about, to our measurement, analysis, and reporting system, and to a messaging and awareness campaign that you'll begin to see here over the next 30 to 60 days.
Are there certain parts of the states or certain counties that really you want to hit hard, or is this?
You know, it's actually it's not. If you look at our issue, we have it in urban areas, we have it in rural areas. It's east, middle, west. There's not a. It's not. This isn't a situation in the state where we can say, "Oh, we have one problem area. If we can clear that up, we'll be in better position."
What are some more incentives besides hopefully lowering insurance rates?
Well, the greatest incentive of all is that we lead healthier lives. So we feel better, we're more productive, we live longer, our healthcare costs are lower. So the great incentive is a personal one to lead a healthier life. We will have a rewards and recognition program with some, as the governor mentioned, some competition and some rewards that happen as a result of participation and achievement in the program.
Can you describe how this is different from programs or initiatives the Department of Health has had in the past?
Yeah, I think a couple of things. First of all, we're bringing more people to the table. Like as Rick said, everything from employers to schools to faith-based organizations, all are coming to the table. Second, I think we're going to do a better job of measuring, and so we can say, you know, I'm just one of those people that thinks, you know, when you're measuring something, if you're keeping score, you're going to do a better job and you're going to put more focus on that. So I think we've actually, part of the money we're going to use to make certain we do a great job of tracking where we are in Tennessee. At the end of the day, it's really about awareness and it's about changing a culture. And in Tennessee, for too long, it's been acceptable not to exercise, not to eat healthy, and to use tobacco. And we're trying to change that.